So today's question is, can you correct deep bite with Invisalign? So let's talk about this. So before we talk about how to correct the deep bite, let's talk about what is deep bite and how can we correct it. So deep bite is when the upper teeth overlap the lower teeth more than 50%, and therefore the lower teeth doesn't show at all. And in these cases, the smile is not very aesthetic, because also with a deep bite, a lot of times the patients show a lot of upper gums, and this is not really an aesthetic smile at all. And none of the lower teeth are usually showing, and this is very common with class 2 patients. The other thing that's very common with deep bite patients, they have a really deep curve of Spee. So this curve of Spee is really, really deep, and they have an arch on the lower arch, which actually results in class 2 and overjet as well. So they usually have overjet as well, and they have an overbite, which is the overbite is the deep bite. By the way, I'm Dr. Nagy. I teach orthodontics to general dentists, periodontists, as well as orthodontists and ortho residents. And if you're a general dentist or periodontist, we have an online program to learn comprehensive orthodontics, so you can help a lot of these patients. So back to the deep bite. So deep bite actually creates two problems again. Patients with deep bite usually have too much overjet, which is actually class 2, as well as unaesthetic smile, because the upper teeth are overlapping the lower teeth too much. So it's very important to correct the class 2 as well as the deep bite. Now, the other neat thing about a deep bite is because the lower arch has this deep curve of Spee in it, a lot of times if you correct the deep bite by correcting the curve of Spee, your class 2 gets corrected in a large way by at least 2 to 3 to 4 millimeters a lot of times. So in class 2 cases, if you learn how to correct the deep bite, you can actually correct up to 4 millimeters of class 2 without having to do anything else other than just correcting the deep bite. Now let's talk about how we correct the deep bite, and the number one way to correct the deep bite is actually leveling the curve of Spee, which is actually flattening that curvature of the lower arch. So that's number one. Number 2, a lot of times with braces, we can also super up the posterior teeth a little bit, and that opens up the bite. The other way to do it is to distalize the upper arch, and by distalizing the upper arch, the bite opens up as well as the class 2 gets corrected too. So those are some of the ways that you can correct actually a deep bite, as well as flatten the curve of Spee, which also corrects the deep bite. Now, there are 3 ways to correct the deep bite, and depending on the severity of the case. If the case is very, very mild, or maybe moderate a little bit, but doesn't have too much class 2, that means like maybe 3 millimeter class 2 or less than that, then a lot of times you can use aligners, assuming that the patient doesn't have severe crowding and they don't need like an extensive treatment. So actually, aligners can be really good because they can be very intrusive in the anterior arch, correcting the deep bite. Now, one problem with aligners is that you have to keep in mind aligners could be intrusive in the posterior arch too, so they can intrude the posterior teeth if you're not careful, and that would actually make the deep bite worse. So yes, you can correct mild or moderate deep bites with aligners, and aligners can work really, really well, but you have to make sure that you intrude the anterior teeth and not the posterior teeth, so you don't make the deep bite worse, but actually you get it better. And what you're trying to do is actually to level the curve of Spee by intruding the anterior teeth, and that will level the curve of Spee and correct the deep bite. The second option for deep bite correction would be just with conventional braces for more severe cases where you have to do some wire bending and actually intrude the lower teeth. Again, we teach this for GPs and periodontists as well. It's not complicated, but you can use braces for that if a case is really, really deep and they need a lot of deep bite correction. The third way to correct the deep bite is actually with surgery for extremely severe cases. This is probably not even 1% of the population, but it's just the third way to do it. So all in all, actually aligners and Invisalign is very good at correcting deep bite by intruding the lower anterior teeth. But like I said, the most important thing is to keep in mind that you don't intrude the posterior teeth, or otherwise your deep bite will actually get worse. So you want to intrude the anterior teeth and level the curve of Spee, and you can actually do this with aligners really, really well. If you have any questions, check out our mini-residency program, and I also offer coaching and mentoring where you can upload your case and I can give you some input for the case and help you treatment plan it and diagnose it. And if you get stuck with the case, we can also hold your hand and kind of walk you through the process. I hope this helps, and good luck to you with correcting deep bite with aligners.